Hi everybody, welcome to the latest community conversation. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System. And today I am pleased to be joined by Dr. Stanley Fiel. He is the Chairman of Medicine at Morristown Medical Center, part of Atlantic Health System. Good to see you, Dr. Fiel.
Thank you, it's nice to be here.
So the premise of this conversation is how to win by quitting smoking. November is Lung Cancer Awareness Month, and today is actually the day of the Great American Smokeout. So a lot of good stuff for us to cover there. Before we do, Dr. Fiel, though, I want to give everybody just a little bit of the run of show here. For the next 15 minutes, Dr. Fiel and I will chat about our topic of the day, but this is, of course, sort of a three-person conversation, if you will. If you have questions, put them in the comments thread below the video. Our team of folks will be following along there, and we'd love to hear from you about anything we talk about or any questions you may have. If you got to drop off, something comes up, got to take a phone call, or for whatever reason the connection were to go down, you can find this entire session on our Facebook page when it's complete or on our website, atlantichealth.org. And then finally, you can also see it on television on News 12 Plus if you have access to that channel. That's Saturdays and Sundays from 8:30 to 9 a.m. So with all of that having been done, all the housekeeping complete, Dr. Fiel, let's talk a little bit about where we are in this effort of helping folks quit or kick the habit, however folks want to refer to it. What are the types of resources available through Atlantic Health System, and what are the types of services and guidance we offer here in that effort?
So the first thing, I think it's important to understand that smoking is a very, very difficult habit to break. And so I think nobody should feel bad that they're smoking. Many people do want to try and stop smoking, and if you ask them, over 3/4 want to stop. Some just say, I don't want to stop, but right. I mean, I think they want to, and we can help them. We have a smoking cessation program here at Atlantic, at Morristown in particular. There are drugs that have been available for a while that are successful. There's what's called nicotine replacement therapy, which is NRT or nicotine, which is really taking nicotine without all the smoke and the additives, either through a patch, through an inhaler. There's a nasal spray with it as well. You can mimic a cartridge of smoking. There are multiple ways to do it, and the gum is probably the most.
That's Nicorette, right? That's the one everybody hears
Nicorette,
about. Yeah.
And it's generally not covered by insurance, unfortunately, but I mean, it's not all that expensive. But clearly, where there's a will, there's a way. And then if there's some questions, and if not, I'd be happy to talk about where does the electronic cigarette fit in, which is really not, right. That's nicotine replacement, but that's got some other issues around it, as we've learned, with some risks that may be associated with that.
And by that, you were talking about products like Juul or whatever,
yes,
other types of things.
Yes.
How has this work, a lot of these products for viewers, depending upon how old you are and different ages, you may be more familiar with some of these products than others, but for years these products didn't exist. These are, relatively speaking, sort of newer products available to folks on the market. How have these technologies and therapies change the way we're able to provide care to people? Have they advanced that effort, made it easier to quit? What's your perspective on that?
Well, in fact, these have been around for a while.
Okay.
I think Chantix is the newest drug that's out there that's been approved for smoking cessation, at least in the last 5 years, maybe longer, I'm not sure.
Okay.
Before that was Wellbutrin, which was another drug that was available for a while. The nicotine replacement modalities have been around for quite some time.
Have they? Okay.
Oh yeah, they have. You know, if you attempt smoking cessation, those people that are successful, and let's say the best studies are maybe 30-35% initially. So that's not great, but a pretty good number if you can knock off 1/3 of people that want to stop smoking and remain 6 months to a year after that period. But it's iterative. People may have to do it again. And
Why do you think that is?
Well, because it's a really, really addictive habit. It's a very addictive habit, and that's why doing these replacement therapies by themselves don't always work. Now, all of us and all of our viewers, I'm sure, have heard or met people that say, I just stopped.
Cold turkey.
I just
call it,
stopped.
right? Cold turkey.
Doctor said, you got a heart, you got this, you got, and people can do that. But because of all the behavioral reasons that you begin to smoke in the first place, and then you get addicted to it, it's tough.
So we talked at the beginning, today is the Great American Smokeout, and as of, if you're watching this live today, as of the 19th when we're recording this, the Great American Smokeout is something held by the American Cancer Society. Again, it's an annual program that they do. But you've talked about this is really a 365-day-a-year process trying to quit smoking, right? It's something that takes time and effort over time. And so programs like our smoking cessation program are out there to help folks. What if somebody were to want to partake in something like that? What types of assistance and therapies can they expect to be provided through a program like that?
So our program it's a standard program. It's not magic.
Right.
It requires a commitment from the patients themselves, and we've got some caregivers that are trained and educated at smoking cessation. I mean, I usually go once or twice during the 8-week session to meet and just answer some medical questions if that comes up. Mm-hmm. But it's basically group therapy in a way, using nicotine replacement therapy, primarily the gum and the patch are the ones that we use, and just a group kind of bearing their reasons for where they're at and trying to answer some questions. And the behavioral piece is actually pretty good. This is not therapy. I mean,
right, the way that some people may perceive that terminology.
But so it's not revealing that kind of stuff, but it really can be very helpful. And like I said, the data is up to a third of the patients will be able to stop.
Wow.
And stay stopped for a period of time.
What are the health implications upon doing this? Maybe some folks who have smoked for a long time said, well, look, I've smoked for years out of my life, there's no point in stopping now. I'm maybe more advanced in age, and what really could I benefit from at this point, having been a smoker for so many years? Are there early benefits that people can see in their health right away? Or what's your message to folks who say it's too late for me to quit now?
So the message is it's never too late. Never too late. Never too early, but never too late. Sure. There's always an advantage whenever one stops smoking. So if you just look in general at smokers, their lives are cut short on average 7 to 10 years.
Because of the smoking?
Smoking.
Wow.
Heart disease, stroke, cancer are the biggies. Chronic vascular disease, vasculopathy. So I mean, it's a major problem, and it's the single most preventable cause of death that we have.
Wow.
So I mean, it's just bad. It's difficult, etc. It's the major cause of chronic obstructive lung disease. It's a big implication now that we've got COVID that's ongoing, and smokers are at higher risk because of their inability to clear viruses and bacteria. So it always can decrease risks whenever. And even, people will say, well, geez, what if I just smoked 4 cigarettes a day? If you can do that. It's not so easy.
Sure.
That's better than smoking 14 cigarettes a day.
Right.
So it really is a game of being able to reduce and improve your health for yourself and your family if you can do it.
So I want to talk about the COVID implications in 1 second, but as I do mention, we have an opportunity for folks to share questions throughout this process. And one of the questions we've received, it was actually sent in before our session started, was from a woman named Therese. And Therese, it sounds like perhaps she may be attempting to quit using the gum, the Nicorette, I believe as it's called. And so her question is, now look, maybe there's a slip up and she sneaks a cigarette in addition to the gum every now and then. Is that dangerous? Can you, are there additional health risks caused by mixing the two, the nicotine replacement therapy and the traditional cigarette?
So one should generally not smoke cigarettes while actively using nicotine. Okay. It's just an additive effect, and you can become ill from too much nicotine. It can make you sick. Increased heart rate, even potentially heart attack if you've got significant heart disease, and it can just make you very sick and jittery, etc. That said, people are people, things will happen as you point out.
Sure.
The Nicorette Gum is a little bit easier to deal with. You just stop the gum, and
Spit
you
it
get
out.
a cigarette. Yeah,
Yeah.
and then you get a cigarette in between. The whole point is not to do them simultaneously. So if you've got a patch on, you don't want to smoke while the patch is active. Or if you're taking an inhaler of either if you're using the gum or the nasal spray as an example, you don't want to do it at the same time. But generally, you just don't want to do it.
Let's talk about the electronic cigarette influence
Yeah.
that we've had here, because obviously that's been such a tremendously growing thing over the last few years. Can we talk about the role that plays in some folks either transitioning away from traditional cigarettes and maybe the risks that are inherent in those as well?
So the issue with the electronic cigarette is that it is a very potent and efficient way to deliver nicotine.
As a delivery system.
As a delivery system,
Okay.
right, exactly. And it's done under heat and vapor. Now, it doesn't have the same implications of smoking. It doesn't have all of the other
Like the additives, like
right,
tar and
right.
things like that.
Doesn't have that, so that's great. And there's no evidence that it causes cancer.
Got it.
But the flavored cigarettes and the heating of that, and there were these teenagers that have had, the lung damage from that called EVALI, the vaping problems, that's real. And the fact that the e-cigarettes are out there and have addicted a lot of our youth.
Sure.
Let's just not get into discussing
aside
that,
for a
but let's
moment.
take you, a cigarette smoker, at a pack a day for 20 years, and you want to get off and you want to know about using e-cigarettes. There is some data that e-cigarettes can effectively help people go from smoking actively to using the e-cigarette. Now the question then is, well, am I going to be addicted to the e-cigarette forever? You may be.
Yep.
And then it's a question of weaning off of that. But being on nicotine alone does not have any of the same kind of very negative health effects that cigarette smoking
That a
does.
combustible tobacco
Exactly, yes.
product would.
And if you're going to use an e-cigarette, first of all, you probably got to deal with your doctor in one of these smoking cessation programs. But if you do it, stay away from the flavored cigarettes, because those are the
Why?
ones theoretically that have some of the potential lung damage to them.
Because of the additives and stuff that they
Additives,
put in
yes.
there. Got it. So, okay, we got a couple questions that have come in while we've been talking. Stephen wants to know, how long does it take for nicotine cravings to pass once you've given up, right? So you're transitioning away from the traditional tobacco or nicotine product, but you're still feeling those cravings. Do we have any data that suggests how long it takes for those to go away?
So, Stephen, the whole idea behind the nicotine replacement is you replace those cravings. So if you're talking about going cold turkey, then your cravings may last up to a week or so. And you might be able to get off during that time if you can do it. The idea is to replace the nicotine from the smoking and just be able to wean yourself off so that you don't have the same problems. Nicotine in your blood is gone within a day, so that's not
Within
really
one
the
day?
issue. Yes.
Okay.
Yeah.
Nicole has a question about how, and this is a tricky one. How do you talk to your loved ones who you want to quit and maybe have been hesitant so far and or haven't reached that point on their own yet? What's your advice for folks who want to try to see if they can convert people into the quitting column?
Well, there's no easy answer to that.
Yeah.
So there's lots of reasons why people smoked in the first place. And I think you can only, guilt may not be the best,
Sure.
obviously, depending on
The individual
what
and
your
all
background
that.
is with
Your
that.
relationship with that
right,
individual.
right.
Yeah.
But I think the reality is you can just talk about improving their own health and why it's important for them.
Mhm.
If it's a loved one, which they described it is, it's important for you because of them as well. It's a delicate balance and dance that one has to do with someone like that, because the guilt piece is probably not a good way to go. Generally, you need to really support why their health would be better off, and their own potential problems later on could be reduced.
We have time, just a little bit of time left, and I wanted to touch on the COVID-related aspects
Sure.
here because it is obviously the topic on everybody's mind right now as it relates to their health and well-being. For smokers who have been looking for a reason or an opportunity maybe to quit, this pandemic would seem to me at least to be, if you needed a time or a reason to stop, this would be it. What do we know currently about the effect of COVID on your lungs and the complications it can provide from a smoking perspective?
So it's a little complicated because everybody that smokes doesn't necessarily develop COPD, or chronic obstructive lung disease. If you do have COPD, then your risk from COVID is accelerated. So that we know that's a significant risk factor. Smoking by itself, if you don't have COPD, doesn't put you in that same risk category. So that's number one. But generally speaking, if you've smoked and you don't have COPD, there's still probably some damage in the lungs' ability to fight infection or ward off viruses, etc. And so you just have a healthier lung if you don't smoke. So it would be a reason, number one, to check if you do have COPD, and that you can be checked out by seeing your family doctor or your internist and just asking for a simple breathing test. You can get that information. And if you don't have, here's the issue though, if you don't have COPD yet or a problem with it, it doesn't mean you won't get it.
Right. So it doesn't mean you're insured against
Right.
having it.
But even just the idea of smoking gives you some increased risk, and you'd want to not smoke for that reason, assuming that's something that may push you to stop smoking.
Dr. Fiel, well, we have one more question about, so there we go. Oh, I do have a question about just general information about accessing resources on the website. Folks, if you want to learn more about some of the resources that Dr. Fiel has been talking about, or just some general information about smoking cessation, go to atlantichealth.org. There is a little text bar right there in the center, and you can type in quit smoking, even just something simple like that. And all the resources you will need can be there. We have a smoking cessation or lung cancer screening program here at Atlantic Health System. There is contact information for all of that as well. Dr. Fiel, we are out of time, but I want to thank you so much for doing this.
My pleasure. Thank you for having me.
All right, folks. Again, on behalf of Dr. Fiel, I'm Luke Margolis. Thanks so much for watching. And if you missed any of this, check it out on our website, News 12 Plus, or on our Facebook page and other social media platforms. Thanks so much for joining us, and have a great holidays.
Thank you.